everybody. Welcome to our second Views COVID-19 seminar series. I'm Steph Scott. I'm a Senior Research Fellow at Newcastle University, and I'm going to act as the chair, particularly because of my capacity as the co-lead for the Complex Systems Views Research strand. So really, I've just got a few housekeeping things to go through first, and then I'll introduce our speaker, Kathryn. So can everybody just make sure that your microphone is on mute? You should have joined on mute, and your videos are off unless you're invited to speak, just to help us with connectivity, really, more than anything. And during the presentation and the Q&A, what we're going to ask you to do is to type your questions into the chat box, just so that I can manage that and put the questions to our speaker, Kathryn. During the social, a little bit later, if you want to speak, just type a question mark into the chat box or raise your hand and we'll pick that up. And if you feel like at any point that someone is behaving inappropriately or you've got any cause for concerns, then please message the host, and that's Laura Ritson. We're also going to be recording the session, just Kathryn's session. We're not going to record the Q&A or the social. And I guess really, it sounds a bit patronising to say, but just to be professional at all times, really. And just to give you a quick run through of our programme, you've got me for 5 minutes, just a brief introduction and housekeeping. And then I'm going to hand over to Kathryn Cassidy, our speaker, to talk to us about solidarity in pandemic times, asylum seekers in forced accommodation. We are going to have a brief response from me, just to lead us into the Q&A, for which we've got about 15 minutes for, so we'll try our best to keep to time. We'll have a short comfort break to take us to 2 o'clock, and then from 2 to 2:30, we'll have a little bit of a coffee social and discussion. So really, I'm just going to hand you straight over to Kathryn Cassidy. Kathryn is an associate professor and a feminist political geographer at Northumbria University, and she's going to talk to us now about solidarity in pandemic times, asylum seekers in forced accommodation. Kathryn, I'm just going to turn off my share so that you can share your screen, okay?
Thanks very much, Steph. Just bear with me a moment while I get this up. Great, you should now all be able to see my screen. So I just wanted to start by saying a huge thank you to Steph and all the others who from Views who've been involved in organising today's seminar, and also for inviting me to give this presentation. It's part of an ongoing project that I'm working on, and it obviously, given the timing, it's something of a work in progress. So I'd be really interested in the discussion and the feedback that we have. I also just want to start with the caveat that obviously I'm not someone with lived experience of the asylum system. So I know that there will be some people on the call today who have lived experience of the asylum system, and obviously I just want to start by explaining that. Okay, so forced accommodation is part of the structural violence of the UK's immigration policies, which alongside the discursive violence of public and political debates on immigration in the UK, put the lives of asylum seekers at risk in times of pandemic. These risks make it impossible for some asylum seekers in forced accommodation to adhere to strict government guidelines, creating and exacerbating tensions within communities and further inhibiting inclusive cultures of solidarity and mutuality. A focus on clinical vulnerability intersects with discourses on who is deserving of support and/or mutual aid in a pandemic context, further shaping exclusionary processes and practices of mutuality during the pandemic. So public health responses, when the impacts upon minoritized communities are revealed, create populations as problems to be addressed. They focus on culturally targeted responses that situate the issues within the population rather than tackling the systemic violences that exclude and render these lives more at risk. The pandemic has highlighted and exacerbated ongoing slow crises, as Kathryn Cassidy has called them, one of which is the forced accommodation of asylum seekers. Government responses to the pandemic have depended on staying at home, with home constructed as a place of shelter. This heightens the need for better understandings of the connections between public health and the geographies of home. So in this paper, I'm going to explore these issues through ongoing research I've been doing in the northeast of England, specifically Newcastle and surrounding areas. Prior to March 2020, I was engaged in a research project that was exploring some of the disorders of immigration policies and practices, the disorders they produce, and also the ways in which they're contested and resisted in everyday life. So the data presented here is part of the ethnographic research that was ongoing as part of that project. It arises from participant observation, which is both virtual and at a distance, with a campaigning organisation in the Northeast, as well as unstructured interviews with members of this organisation and mutual aid groups. In addition, secondary data has been gathered from various public and third sector reports and meetings, as well as from parliamentary debates and the media. I'm aware that some of the audience for today's talk, you come from quite varied backgrounds, and many of you will be familiar with some of the national and regional processes shaping the asylum system. However, I'm going to start with a rapid summary and analysis of asylum housing for those who aren't familiar. I want to illustrate how the wider policy environment has shaped the specific issues that have emerged during the pandemic in the Northeast. And I'll follow this review with a look at some of the lockdown measures, or what I call kind of shelter in pandemic times. So look at some of the lockdown measures and supporting legislation and its relationship to forced accommodation for asylum seekers. In the final two sections, I'll move on to explore questions of mutuality and mutual aid, firstly through a very brief introduction to the academic literature on the topic, and then secondly, in the final section of the paper, I want to explore the impact of forced accommodation of asylum seekers on cultures of solidarity and mutuality in the Northeast. Okay, so Mark Bernadotte uses the terms constrained and forced housing to refer to the mass housing of asylum seekers and refugees in camps and other forms of accommodation in France. Denial of access to employment, higher education and public funds in the UK force many asylum seekers into destitution and leave them no option but to enter into a forced housing system, which is embedded in the 1999 Immigration and Asylum Act. This legislation emerged from concerns relating to the geographies and costs of housing asylum seekers and sought to, quote, to relieve the burden on provision in London. So the white paper from 1998, which lays out these concerns, also raised questions about the number of so-called bogus asylum claims, as well as the backlog in processing these claims. The 1999 legislation therefore sought to address these three issues. In relation to housing, the aim was effectively to cut the self-imposed cost to the state of housing asylum seekers by moving them out of accommodation in London and the South East, where accommodation was significantly more expensive, into areas of surplus accommodation in the rest of the UK. The legislation established that the preferences of asylum seekers should not be taken into account when deciding where to house them. However, their needs, particularly their medical needs, should be taken into account. The term dispersal served really to obfuscate the processes involved, which for those who'd already established themselves in the UK was forced displacement to other areas of the country, and for those who sought asylum on entry meant forced mobility, often for short periods of time and moving around rapidly. So that's why I use the term forced accommodation to refer to this approach to housing asylum seekers. These systems make solidarities with majority and other minoritized populations very difficult. Those with status in the country who have not sought asylum are often not aware of the processes and practices of seeking asylum, and this makes one of the first steps in mutuality the generation of understanding. The dispersal system has been widely critiqued in the academic literature for its impacts on social cohesion and the lack of support offered in dispersal areas and the uneven geographies of dispersal. The initial contracts between the Home Office and local authorities were renewed in 2005, but with reduced funding, which the Labour administration argued would save £37 million in 1 year. This put increasing strain on local authorities with the most asylum seekers, such as Glasgow. By 2010, relationships between the Home Office and some of the key local authorities providing asylum accommodation had become strained. There were two key issues. Firstly, lack of willingness to manage housing by local authorities, and also concerns about levels of funding supplied by the Home Office to the local authorities. So this meant in 2010, when the coalition government came to power, they introduced austerity measures across a number of departments, and that had a particular impact upon accommodation of asylum seekers. So the October 2010 spending review fixed spending for government departments until 2014-15, and for the Home Office, which had an annual budget of 10.2 billion, current spending was reduced by 23% and capital spending by 49%. By 2010, the Home Office had 22 contracts with 13 suppliers to provide forced accommodation to asylum seekers, which were a mixture of local authorities, private providers, and the third sector. In 2011-12, forced accommodation cost the Home Office £150 million. In March 2012, the Home Office signed 6 new contracts, known as the Commercial and Operating Managers Procuring Asylum Support, or COMPASS contracts, with 3 providers. The COMPASS contracts sought to save 140 million over 7 years. In 2012-13, the saving was just 8 million. G4S and Circa were 2 of the new contractors with no experience of this type of provision, and they struggled to implement the contracts from the very beginning. Meeting housing supply demands in a number of areas was only achieved through subcontracting. The financial constraints of the 2012 contracts meant that asylum accommodation became more concentrated within areas where accommodation is cheap and more readily available. Existing dispersal areas were asked to accommodate and support increasing numbers of asylum seekers. And the number of asylum seekers accommodated under Section 95 in particular at any one time has increased steadily since 2012 as well. So in addition to the issues relating to the areas into which asylum seekers were dispersed, several organisations raised concerns about conditions in dispersal accommodation under the COMPASS contracts. These are summarised in a report published by the Home Affairs Committee in 2017. In the report, the committee described how they have received evidence that people are being placed in accommodation that is unfit for habitation, or which ends up in such a condition due to poor maintenance. In relation to the standard of the accommodation provided, the report further notes issues with vermin, asbestos, cleanliness, poor quality or unusable furnishings and facilities. The committee also reported on failures to deal with complaints and that some asylum seekers were subject to abuse and/or intimidation when making complaints. They also raised concerns about the efficacy of the inspection regime. And finally, there were serious concerns about the lack of consideration given to the needs of individuals when allocating them accommodation, and also overcrowding. The committee highlighted that they had received reports of transgender and heavily pregnant women being forced to share rooms with unrelated strangers, as well as those suffering from PTSD and other mental health complaints. In addition, people with mobility issues were allocated inaccessible accommodation. Whilst the COMPASS contract stipulated that individual circumstances must be taken into account when placing asylum seekers in accommodation, the evidence given to the committee suggested that this was frequently not the case. So the COMPASS contracts were initially set to run for 5 years, but just as they had done with the previous cycle, the Home Office didn't find alternative arrangements, didn't have alternative arrangements in place at the end of the contracts, and so they were extended for 2 years until the 1st of September 2019. On that date, the contracts were replaced by 2 new contracts with 4 providers, the Asylum Accommodation and Support Services contracts, which are known as ASC, covering 6 regions. And those, so Circa and Clear Springs continue to be providers, but G4S lost their award, and it was given to Mears Group, who were a social housing maintenance contractor and provider of care accommodation, and they provide the forced accommodation in the North East. Alongside the ASC contracts, the Home Office also introduced an Advice Issue Report and Eligibility Assistance Services, or AIR contract, which was awarded nationally to Migrant Help. And again, we can come back to some of this hopefully in the discussion. Rather than the 5-year contracts that had run previously, the ASC and AIR contracts of 10 years at a cost of £4 billion. The conditions described in the report by the Home Affairs Committee were found in much of the housing in the North East of England, but the history of contracts for forced accommodation also left a particular legacy in the North East, where the contractor G4S supplied some of the housing and the rest was supplied through a subcontractor, Jomast. The latter had been supplying accommodation for asylum seekers in the North East since 2010, when they had been awarded an interim contract by the Home Office after the end of the previous contract period. Jomast is a Teesside-based property development company that rose to national prominence in 2016 when it was found to have painted the doors of all their asylum seeker accommodation red. In 2017, Newcastle City Council introduced a policy of no forced room sharing for unrelated adults to address some of the concerns about overcrowding in asylum accommodation. Whilst other local authorities had done the same, and the main contractor G4S for the most part had been compliant, the refusal of the subcontractor JOMAS to comply brought them into conflict with the local authority in 2017-2018. Newcastle City Council issued overcrowding notices and also refused a variation on an HMO used by JOMAS to house asylum seekers. And then JOMAS then challenged this through a first-tier property tribunal in March 2018. And this property tribunal is important in the sense that it notes particular conditions about the forced accommodation of asylum seekers, which I think are important for us to bear in mind. In particular, it notes that there's no direct contractual connection between JOMAS, so the supplier, and the occupants themselves. And it notes this kind of anomaly of this particular type of accommodation as well, because there's no kind of tenancy regulations in place, that actually that the contractor is just fulfilling a requirement to the Home Office for accommodation. So the tribunal found in favour of JOMAS, and although it considered the notices issued by the council to be well-intentioned, it noted that they were not supported by existing law and they were therefore quashed. So this brings us to September 2019, when the new contracts with MEARS, the ASK contracts for forced accommodation, were brought in the region. And they were left to deal with some of this legacy of the subcontractor JOMAS. They were unable to reach a deal with JOMAS, and they were forced to displace some asylum seekers into transitional accommodation as they sought to procure and renovate more properties in the Newcastle, Gateshead and surrounding areas. By March 2020, as we move into the period just before the lockdown measures were introduced because of the current pandemic, some asylum seekers remained in transitional forced accommodation in the region. And this failure to fully transition all asylum seekers accommodated under these contracts into suitable, safe accommodation has had a devastating impact on the risk to life posed by the current pandemic. It's important to understand these differing historical trajectories, but also the uneven landscape of forced accommodation for asylum seekers prior to the pandemic. Those who have remained in transitional accommodation have predominantly been single asylum seekers, as families, especially those with children, were prioritised during the transition. However, this unevenness was also shaped by JOMAS' refusal to adhere to the no room sharing policy, which meant many single asylum seekers were also amongst those who needed to be moved to temporary accommodation when negotiations with JOMAS failed. At the beginning of the pandemic in March 2020, some asylum seekers in the Northeast continued to be housed in unsafe accommodation that was present under the previous Compass contracts. In particular, the transition left some asylum seekers in hostel-style accommodation with failing electrics, rat infestations due to a failure in rubbish collections, inadequate food storage and cooking facilities. All of these issues were presented in forced accommodation provided by the ASK contractor when the decision was taken by national government to implement lockdown measures in the light of the coronavirus pandemic. So I'm now moving on to look at the kind of the national context from March. So responses to the COVID-19 pandemic have relied upon physical distancing policies to prevent the spread of the disease. Instructions from the UK government, like so many others, have assumed that home offers a space, a place of safety and protection in which occupants can shelter from the pandemic. So this is from the letter that Boris Johnson sent out to households in the UK. That is why we are giving one simple instruction: you must stay at home. You should not meet friends or relatives who do not live in your home. You may only leave your home for very limited purposes, such as buying food and medicine, exercising once a day, and seeking medical attention. You can travel to and from work, but should work from home if you can. Such instructions made staying at home a political act of solidarity and care, as Kathryn has described it. However, lockdown rules and their enforcement were also legislated for very rapidly in the Coronavirus Act. The health protection restrictions direct that people are not able to leave the place where they are living without reasonable excuse. In defining what a reasonable excuse may be, at the very bottom of the regulations, a reasonable excuse also includes to avoid injury or illness or to escape a risk of harm. As Brickell has highlighted, the protection that home is expected to offer is not experienced equally. Indeed, early on in the pandemic, there were important interventions in challenging the assumed safety of home based upon existing literature on domestic violence. However, the focus on this particular form of harm came to dominate the legislation and guidelines for its operation. So here we see some of these references to this. In particular, the top one relates to instructions that suggest that household isolation instructions as a result of coronavirus do not apply if you need to leave your home to escape domestic abuse. So these things were explicitly stated. And then again, we'll see in terms of the enforcement of the lockdown measures as well, that police were particularly instructed and given operational guidance that they would keep an inquisitive questioning mindset and consider whether any safeguarding issues were at play. So I think these were all kind of pointers that were directing towards particular kind of forms of harm. So such guidance, whilst important, can create definitions of harm which obscure other harms that might prevent risks to safety and shelter in the home. So indeed, it's unsurprising that a policy-making definition would ignore the harmful conditions in forced accommodation provided under contract to a government department. In addition, one final point I want to make in relation to the policy-making environment surrounding the pandemic relates to the creation of a definition or discussions and wider discourses around the idea of vulnerability. And this idea of vulnerability focuses on clinical vulnerability to the virus if it were to be caught, rather than structural conditions that might render particular people vulnerable to catching the virus. Caring for the clinically vulnerable was held up as a collective responsibility. So here we see Matt Hancock from back in March. Tackling coronavirus is a national effort and everyone has to play their part. The more people follow the public health advice, the less need to bring in draconian actions that I'm keen to avoid. Of course, we must not forget the simple things that we can all do. And this obviously includes, as it says, looking out for the most vulnerable in the community. So this kind of reference to vulnerable I'll come back to. So in response to demands to address some of the structural vulnerabilisation of certain groups, such as those with no recourse to public funds, which includes asylum seekers, the Secretary of State for the Home Department, Priti Patel, made the focus on clinical vulnerability very clear. So this is Priti Patel in June. The government have made it our priority to protect the vulnerable throughout this national emergency, but we do not believe it's necessary to suspend NRPF condition to do so. It is right that migrants coming to the UK are financially independent. However, practical support, and then she explains the rent protections and the coronavirus job retention scheme also apply, and also that funds have been allocated to local authorities and charities. As we shall see, these discourses of harm and vulnerability relating to coronavirus intersected with popular understandings of vulnerability in the context of mutual aid and responses to the pandemic locally in the North East. Okay, before I move on to my analysis and to look at some of the impacts of forced accommodation on mutual aid during the pandemic, I just wanted to say or outline a couple of things about mutual aid, mutuality and cultures of solidarity. In his paper on COVID-19 and mutual aid, Simon Springer argues that in times of crisis, mutual aid is pragmatic and comes to define our responses at a community level and as a species precisely because it's the most paramount element of our survival. And he's basing this on the work of Kropotkin, who argued that as well as competition, throughout evolution, there are examples of the importance of mutual aid and cooperation amongst and between species in order to survive. So for Springer, it is reciprocity that will enable us to overcome the pandemic. And he claims that understanding of the need to expand our circle of care beyond family and friends is growing. Springer appears to make the assumption that we might expand this circle equally to care for all through mutual aid. However, as we'll see, mutual aid initiatives are often embedded in existing social hierarchies and understandings of who is deserving that are exclusionary and during a pandemic can also be life-threatening. Historical analyses of social movements have often pointed to these uneven cultures of solidarity. Kelleher, in his analysis of solidarity between London and the coalfields in the 1970s, argues that the mutuality between activists was a culture of solidarity which was uneven and contested. Sundberg has emphasised difficulties in organising across difference, and we'll see some of those, and the power symmetries that shape solidarisation as a process. we need to consider that support in exceptional times depends at least in part on the networks built up over a longer period. Solidarity emerges from mutual relationships which are constructed and negotiated. Solidarity over one particular issue, such as labour solidarity, can coexist with exclusions, such as on the basis of race. Therefore, in reading for mutuality, we need to be sensitive to the fact that solidarity can entrench hierarchies of power as well as challenge them. And as we shall see, cultures of solidarity are contingent and produced through struggles. So in this final section of my talk, I want to explore the impact that the forced accommodation of asylum seekers in Newcastle and surrounding areas had upon the landscape of mutuality during the coronavirus lockdown. In particular, I want to show how forced housing intersects with wider views on asylum and immigration, as well as more recent constructions of harm and vulnerability to create contingent solidarities and mutualities. Food poverty was an issue amongst asylum seekers prior to the pandemic. This was exacerbated by price rises and scarcity before and after the introduction of lockdown measures. However, the need amongst asylum seekers in forced accommodation was not even, as one volunteer delivering food parcels to hostel-style accommodation, tongue twister, for asylum seekers explained. Literally, they need everything. £5 per day is not enough for one person. They usually eat outside. The cheapest sandwich is £3.50. You don't have a separate fridge to put your food in. Here, the structural conditions in the accommodation meant that asylum seekers housed there were used to eating outside the hostel prior to lockdown and had no space for secure storage of food within the accommodation itself. This meant that asylum seekers were more likely to leave accommodation more frequently, but price increases also meant that their need for food support was extremely acute. In addition to food storage, the accommodation itself remained infested by rats due to the lack of bin collections, and there were problems with cleanliness. Many of the occupants of this particular hostel-style accommodation went to stay with friends for periods of time to escape these conditions because of fears regarding their health. Another volunteer with the campaigning organisation commented on the presence of the housing provider. I mean, the managers are supposed to come once a month or so. I saw the housing manager once in 3 to 4 months. I took him on a walk around the hostel and showed him what was wrong. He just takes his salary without knowing anything. How could he be responsible for 66 people? How could you stop the virus in this situation? That some asylum seekers weren't able to join the political act of solidarity and care of staying at home in unsafe and inappropriate accommodation was a direct inhibitor to the development of cultures of solidarity, exacerbated by a lack of accessible information given by the housing provider. A volunteer in a mutual aid group noted excess policing in the area where they lived and were distributing food and toiletry packs. So there were some issues with asylum seekers being reported to the police by locals because they would see them together in groups outside. The harm highlighted in discourses and legislation focuses on a particular form of harm, domestic violence. The harms of forced accommodation for asylum seekers inhibited the development of solidarity with some members of the local community, but also within the accommodation itself. Concerns over cleanliness and disputes over the delivery of food parcels and their storage led to arguments and tensions within hostel-style accommodation. Mutual aid groups were set up and intended to be organised based upon area or place. However, it became clear to one volunteer that those volunteering to run and support one group were doing so based upon particular perceptions of what that area was and who belonged there. Some of these hierarchies appeared to be classed, as we can see in the first statement. So when they say, and she was talking about a particular ward in Newcastle, they don't mean the estate. They naturally don't mean the estate. They want to use the name of the ward boundary, but they don't want to mean the ward boundary. They want it to mean whoever already matters to them in that ward boundary. And others also appeared to be racialized or based upon immigration status. And they can make invisible the neighbours who don't look like them. That's natural. Those people are naturally not who they're talking about. And they can make invisible the housing that's right next to them because that's clearly an estate or those are tile blocks. In many cases, support continued to be provided based upon existing solidarities. So there's an example of one asylum seeker who provided food parcels to other asylum seekers and refugees across the Newcastle and Gateshead area during lockdown. Many support organisations were forced to close, but some continued or switched to offering food and toiletry packs. However, one volunteer sought to challenge these exclusions in their local mutual aid group to kind of open up and make them accountable for all of those living in the area. So this person explains here that some of what they were doing was they were trying to avoid this ghettoisation within some of the mutual aid groups. And explains that this involved conflict and fighting with some of the people within these mutual aid groups, and that took a lot of effort, that when we're talking about community, when we're talking about a neighbourhood, that includes everyone, so whether that's homeless people and migrants who live in that neighbourhood as well, and that's something that this person was really keen to push forward. And part of what emerged from that was a sense that the needs of these, particular groups should be taken care of by someone else. So a lot of the responses that this person received were that they were pretty sure that the Home Office looks after these people, etc., etc. So reading for mutuality in the context of COVID-19 illustrates the contingency of solidarity within mutual aid groups. There was an expectation amongst some members regarding to whom support should be given. These expectations were framed by wider public and political discourses, but also by perceptions that caring for others should be part of targeted support organisations, many of which were not operating. So the final point that I want to come to is really about this question of vulnerability. So as vulnerability was such a key element in the framing of the government's response to the pandemic, it also emerged in conversations amongst mutual aid groups and networks as they tried to set up some of the structures of support in communities. And in some cases, concerns about vulnerability were linked to existing structures on safeguarding. And one of the volunteers that I spoke to in Newcastle explained their frustration about some of these processes. So they talk about the fact that they end up trapped in this conversation about vulnerability rather than actually thinking about how to meet the needs of those within their community. And this ended up in quite a kind of complex situation. So discussions on vulnerability amongst mutual aid groups reflect some of those we see in relation to immigration, as they delineate certain people as deserving, undeserving of aid, rather than looking at need. And as we saw in the previous section, this determination of whether someone is deserving or undeserving is developed based on limited understanding of the structures that might be driving that need for support. One mutual aid volunteer in another part of the region with lived experience of the asylum process explained how these ideas also impacted upon his engagement with one man when he was delivering him food as part of a mutual aid group. So he talks about this experience of this man being angry, and he interpreted that as that was because he was Black and he was helping him. So this volunteer continued to view the needs of those he helped as part of the mutual aid group. So he talked about how he knows that people are suffering. If you have money but you can't go out and buy food, then you'll also starve. So he talks about having to serve each other as a community. This volunteer and others noted how the system was failing to keep many people safe, and not just those who might be defined as clinically vulnerable. Okay, so I'm just going to move to some quick conclusions. So in this presentation, I've sought to elucidate how the forced accommodation of asylum seekers in the UK left some asylum seekers in the North East unable to safely shelter at home during the pandemic, creating tensions in local communities and inhibiting the cultures of solidarity that underpinned essential mutual aid networks. These systemic harms and exclusions intersected with other social hierarchies during the pandemic in ways that impacted not on the health of asylum seekers, not only on the health of the asylum seekers concerned, but also the communities within which this accommodation is located. As Brickell has argued, the pandemic has shown that without the right to home, other rights are much harder to achieve. Home is the intimate core of livable life. So while Springer may be right in his assertion that the pandemic has marked a profound revival of mutual aid in our political awareness, the mutuality underpinning these efforts has been uneven and contested. Public Health England have suggested that the effects of hostile environments against immigrants, particularly failed asylum seekers and undocumented migrants, might affect settled BAME populations adversely through heightened prejudice and societal tensions. However, the effects of hostile environments extend well beyond heightened prejudice and societal tensions to systemic failings in forced accommodation that heighten the risk to life for some asylum seekers during the pandemic.
Thank you, Kathryn. That was fantastic. I was just checking you were finished before I come back in. I'm just going to make a couple of points as a respondent and chair, and just kind of talk about the public health implications of some of the things that you've said. And there's two kind of key points that I want to make really before I open it out for questions. The first is just to kind of to reinforce how important accommodation and health and housing can be as a social determinant of health. If we put the pandemic aside just for a minute, a recent systematic review, I think it was 2018, explored the effects of housing and health for this particular populations and including refugee populations. And they found all of the studies included in that systematic review identified housing issues and identified physical housing conditions to be particularly poor, and that particular groups will experience issues such as affordability, suitability, insecure tenure and mobility, as well as difficulties securing housing in the first place. And those were found to have profound impacts on both physical and mental health, but also impacts in terms of vulnerability when it comes to safety and overcrowding, such as the issues that Kathryn's just been talking about now. So the first point I wanted to make relates to the importance of housing, but the second point I want to make relates to the potential problem of stigma in public health, and in terms of the idea that some people are more deserving of help than others, and the impacts that that can have on people's mental health, and the way we see individual stigma as well as things like territorial or place-based stigma, such as the issues that Kathryn identified in terms of the potential for people to see certain areas as ghettoised.